So we're wrapping up day 3 of the governor's stay-at-home order. How are you doing? Are you relaxed? Stressed? Well, if you're feeling stressed out tonight, I want you to hear that this mental health expert and what he has to say tonight.
And what suggestions do you have to help us ease the tension that may develop of everybody being at home?
Well, I think it's very important, especially now that we're truly in close quarters, that we get out our little irks about things as they happen. You know, a lot of times when people get a little frustrated with something, they just kind of slough it off and say, I'll address that later if it becomes an issue. But you know what? It's going to become an issue, and things could blow up pretty quickly. So let's address things right when they happen.
What signs of distress should we be looking for?
I think now people would fall into kind of 3 main categories: either really, really anxious and afraid, really frustrated and angry, or perhaps even very despondent and depressed.
And let me talk about that depression. What would be some of the signs that somebody is depressed about what's happening in the world?
Well, you know, it's funny because people can be withdrawn when they're around millions. So it doesn't matter if you happen to be indoors. I mean, somebody could be quite a delight to be indoors. But if someone is withdrawing into themselves and not talking as much out loud, not wanting to face people, not taking care of their hygiene, eating and sleeping is disrupted. Those are the things we want to pay attention to. Of course, if anyone says anything about thinking about suicide or feeling suicidal, that's something that has to be paid attention to right away.
A lot of the kids are going to be inside a lot more than they're used to being, and they can't really process perhaps what they're feeling. What advice do you give parents in terms of talking to their children about what's been going on and how we should all handle this stay-at-home order?
It's important. I love the word order. Okay, so that's the very important key here, is that we try to maintain some kind of normal structure as best we can. It's not in the normal places, of course, but you have a time where you get up, you have a routine, you have your meals at certain times, and certainly you have a nice, good bedtime routine, or they call it actually sleep hygiene. In between there, it's really helpful to get some physical energy out. And if you can go outside, that's awesome.
Kimball, what about ways of trying to turn this into a positive experience?
That's a great point. I have been sitting at my dining room table for hours and hours and hours over the past several days, and I've seen so many people outside walking their dogs.